Chronic fatigue syndrome, or CFS, is a debilitating condition that leaves people with persistent exhaustion, cognitive difficulties, and physical limitations that don't improve with rest. Many believe that CFS is a lifelong illness with no real hope of recovery. But is that really true? The PACE trial, a large multi-center study, set out to determine whether people with CFS can recover and what treatments are most effective in helping them do so. This research followed 641 participants over a year, testing 4 different approaches: cognitive behavioral therapy, CBT, graded exercise therapy, GT, adaptive pacing therapy, APT, and specialist medical care, SMC, alone. The findings were clear. Patients who received CBT or GET had significantly higher recovery rates compared to other treatments. At the 1-year follow-up, 22% of participants in both the CBT and GET groups met the criteria for recovery, compared to only 8% for APT and 7% for SMC alone. This means that people who engaged in structured cognitive and behavioral therapy or gradually increased their physical activity had 3 times higher odds of recovery than those who only received standard medical care. So how do these treatments work? Cognitive behavioral therapy, CBT, helps patients change the way they think about their illness, reducing fears of activity and shifting their focus from avoiding exertion to gradually increasing their abilities. Graded exercise therapy, GET, follows a structured program where patients start with low levels of physical activity and progressively build up their stamina over time. To understand what this means in real life, let's take an example. Sarah, a 35-year-old woman, had been struggling with CFS for 3 years. She avoided physical activity, fearing it would make her symptoms worse. After starting CBT, she began to challenge her beliefs about fatigue and slowly introduce small amounts of activity. Meanwhile, John, another patient in the study, followed GET, starting with short, controlled walks and gradually increasing his movement over several months. By the end of the study, both Sarah and John had significantly improved their quality of life and no longer met the criteria for CFS. However, the study also highlights an important reality. Recovery does not mean being entirely symptom-free. The researchers define recovery as returning to a functional level comparable to healthy individuals, not necessarily eliminating every symptom. In fact, the general population also experiences occasional fatigue, headaches, or muscle pain. The goal is not perfection, but regaining a manageable and fulfilling life. One of the most controversial aspects of this study is that some patients and advocacy groups have criticized the way recovery was defined. The study used multiple criteria, including symptom severity, physical function, and self-reported improvement. But some argue that the thresholds for recovery were too low. While the results clearly show that CBT and GET are the best studied treatments for CFS, ongoing research is needed to refine these approaches and ensure that all patients receive the support that works best for them. So what can we take away from this study? Recovery from CFS is possible, and structured therapy and physical activity play a key role. If you or someone you know is struggling with chronic fatigue, consider speaking with a healthcare provider about evidence-based approaches like CBT and GET. While there is no one-size-fits-all solution, this study provides hope that people with CFS can improve and even recover over time.